What are some tips for a heart-healthy diet?
The ideal heart-healthy diet is one very similar to a Mediterranean diet. I often tell people it's almost common sense, but again, it depends on what you like. Well, what are the foods that are bad for you? Well, in a Mediterranean diet, there's very little red meat. I often tell people red meat once a month. Chicken, lean, occasionally, avoid the skin. How you prepare the food, avoid frying the food. Fruits and vegetables, very important. Again, if you have a plate of food you're having for dinner, first of all, make sure that plate is not massive and that you constantly refill that plate. The second, look at your plate and say, well, how much of that is fat? How much of it is meat? How much of it is chicken? Is it the right type of meat, chicken? Well, what kind of good meat would there be? Lean meat, like a lean cut of pork, a lean cut of chicken without the skin. Most of that plate should, in fact, be vegetables, grains, things like white beans, lentils. The foods to avoid, the saturated fats. Well, where do we find saturated fats? Creams, butters, whole milk.
I heard that salt can be bad for you. How much am I allowed to have per day?
Well, salt is an important part of our diets, and it's almost included in all the foods that we eat. The amount of salt in your diet really depends on your age and your cardiovascular risk. There's pretty much an agreement that in our diet that we have much too much salt. And salt, we label this as sodium. And the amount of salt in your diet really depends on, do you have high blood pressure? Do you have congestive heart failure? Are you retaining fluid? The ideal amount of sodium in your diet, if you're a healthy person, is probably around 2,500 milligrams of sodium. And that's not much. That may be equivalent to slightly more than a teaspoon of salt. Many people think of salt as what they put on a salt shaker and put on their food. But sodium is in everything. It's in canned and processed foods. It's in seasonings. So it's something you need to read your level, understand how much you're taking every day. If the doctor says cut your salt back, what does that mean? Do you understand it? If not, learn how to read labels. There's a lot of information there about what's in your food, how much you should be taking on a daily basis. Basically, just don't say, I'm not using a salt shaker. You should say, well, this is what I have on a regular basis. I had a can of soup for dinner last night. Well, soups are loaded with sodium. Fast food is loaded with sodium. If you have cardiovascular disease, the intake of sodium should be even less. 1,500 milligrams a day is probably too much salt if you have congestive heart failure, high blood pressure, or have had a stroke. What I would suggest if you've had this condition is to minimize the salt intake. Try to do significantly less than 1,500 milligrams a day. Read your labels. Learn how to read package inserts. Try to, when you go out to eat, ask them, avoid adding the salt, preparing the food with salt, adding spices that may make it additionally salty or have sodium in it.
What are the statin medications, and are they safe?
The statins are an important part of managing cholesterol and reducing cardiovascular risk. Statins are a group of medications that include the trade names of Lipitor, Crestor, Zocor, Simvastatin. There are many out there, and they're very effective. Again, the use of them has to be individualized based on your risk. What is your cholesterol? What are your numbers? The statins came around 1987, and they made major differences in the reduction of heart disease. But again, it really depends on what your risk is. If you've had a heart attack, if you had a stroke, and you have significantly elevated cholesterol, a statin may be for you. But again, it's something you have to individualize. So statins are cholesterol-lowering medications. They work through the metabolism, the way your body makes cholesterol. If you have an elevated cholesterol, you should ask your physician, what is your good cholesterol? What is your bad cholesterol? Many people often say they don't want a statin. They're concerned about side effects, and statins do have side effects. Most of those side effects are not life-threatening, but they're annoying. They could be as annoying as muscle cramps, heaviness of the legs. These are things, if you get started on a statin, you should ask your doctor, could they be related to that? Could they be related to arthritis? Could they be true and unrelated? So it's important to, again, bring up these questions. If you need a statin, say why, how will you be monitored, how often. They do lower your cholesterol. Many people also say before they get a statin, a cholesterol pill, should they try diet and exercise? Absolutely. A diet and exercise can lower your cholesterol dramatically. The statins are just one additional medication that we could use to get you to a low cholesterol. If you've had a cardiac event, such as a heart attack, a bypass, a stent, or stroke, These medications can further reduce your risk for future heart attack and stroke.
My friends have told me that a glass of wine a day is good for you. Is that true?
Wine has received a lot of attention in terms of reducing heart attack and stroke. There's evidence that small amounts of alcohol may have cardiovascular benefits. Again, I stress small amounts. And it's actually not just wine. It could be any type of alcohol, the alcohol in hard alcohol, the alcohol in beer. It's probably 1 ounce a day. More than that, in fact, could be very dangerous. Alcohol in large amounts can weaken the heart muscle. It could exacerbate high blood pressure. It could affect the other medications you're taking. So red wine, if you have a glass a day, fine. If you have several glasses a day, much too much. I don't tell people to take an alcohol or glass of wine to reduce the heart attack risks. I say use moderation, avoid more than 1 or 2 glasses if you're a male, and women's actually even less. 1 ounce a day is probably enough to prevent cardiovascular risk, but more than that is dangerous.
At what age do I need a stress test?
There's no clear-cut age when one needs a stress test. It really depends on how you feel, what's happening in your life, and what you want to do. If you have symptoms of tightness, burning, shortness of breath, you feel yourself getting easily fatigued for unexplained reasons, if you have strong family risk factors for heart disease, it may be time for a stress test. So there's no cutoff. There's no age saying you hit 40, you hit 50, get a stress test. It really depends on how you're feeling, what you're doing, and what you intend to do. All this goes in the context, what is your risk? Do you have high blood pressure? Do you have diabetes? Did you smoke? Do you have high cholesterol? Did your family have premature heart disease? A stress test is just one tool to help guide your physician in determining your risk. It's not the only risk. So clearly, bring this up, but stress tests are not mandatory. They should be used on an individual basis depending on your risk. If you had an event, if you had a heart attack, or if you had a bypass, or you've told you had blockages, your physician may recommend a stress test on an annual basis. Again, it really has to be individualized by your risk, what your symptoms are.
Is olive oil good for you?
Olive oil is a healthy fat. It's something that, in moderation, is probably beneficial for your arteries. And what I mean by moderation, a tablespoon of olive oil has about 130 calories. So if you're watching your calories and you're dieting, don't pour the olive oil liberally. Use small amounts of it. In terms of cooking, it's much better to cook with olive oil, small amounts, than butter. If you're making a salad, small amounts of olive oil is probably a better dressing than using a processed bottle dressing. But again, be wary. There are calories in olive oil.
Should I take a daily aspirin to prevent a heart attack?
Well, the question of aspirin is a very important one, and I think it's something clearly you have to address with your doctor. In general, we know that aspirin can reduce the risk of heart attack and, may prevent stroke. If you're a male over 45, there are benefits of preventing heart attacks with a single aspirin a day, and a dose of 81 milligrams can, in fact, prevent a heart attack. What really is very important, though, to identify what is your risk. Did you smoke, or do you currently smoke? Do you have high blood pressure, high cholesterol? All these things go into the determination of an aspirin or no aspirin. So if you go see your physician, I would say, do I have the risk? Should I take an aspirin? And if you're above 45, that's a question you must ask. For women, it's a little different. At a slightly older age, around 55, you should begin asking your physician, should I take an aspirin every day? Again, it comes down to the risk and benefits. If you smoke, you have high blood pressure, a family history of heart disease, this is an important question, and in fact, you may benefit from aspirin. Well, what are the downsides of taking an aspirin? Well, if you're healthy, you have no risk factors, it may not prevent a heart attack, it may not prevent a stroke, and in fact, it can cause ulcer disease. So ask your doctor, know your risk. Consideration for aspirin should be made for both men and women, slightly different ages, but it can save your life.
Is it safe to take those pills for ED?
ED, or erectile dysfunction, is a very common problem. Many people are reluctant to talk about it with their doctor, but it's very, very important that you bring this up. There are many causes for it. Erectile dysfunction could be brought on by some of the medications that you're taking. It could be brought on by undetected or untreated diabetes. It could be emotional, but there are clearly physical reasons for erectile dysfunction, and ED is something that could be easily treatable. The medications that we use for this have been around for years, are very effective, and with your physician prescribing them and telling you the do's and the don'ts. So again, bring it up with your doctor. If you feel like you have ED, don't be embarrassed. We have medications that have been around, that have been shown to be safe, but do it without guidance. If you have any further questions, you could visit our website, winthrop.org, or call our toll-free number, 1-866-WINTHROP.